The people that work here are wonderful people. You see it in their face. They always have a smile. They're always there with a hug, asking you, how are you? Is there anything I can do to help you? I have never been to a place as friendly, as concerned as American Indian Health.
My name is Ashley Tomey. I'm the Executive Director here at American Indian Health and Family Services. Aihfs provides the crucial medical, behavioral health, health education, and other community programs for the community members here in southeastern Michigan. In addition to providing these services, Aihfs also serves as a home for many of the natives here in the community. For those who are not able to get back to their reservations, Aihfs is a place where they can participate in their cultural traditions and have a sense of belonging within the community.
Hello, my name is Nancy. I've been a part of American Indian Health for a very long time. Right now I attend the Women's Circle, and it helps me through rough times, and I really enjoy coming to the circle so we can, the women, we talk about our problems or whatever makes us happy. And
the American Indian Health and Family Services is important to me because they are family, supportive, they're non-judge, they don't judge you.
And they make you feel as if you're important.
I think of Indian Health as a place to heal, not just mentally, but also spiritually as well as physically. It is a connection between all different cultures as well as being native.
And it's a lifesaver for me because most of my family, my family members that would have been there for me, they're dead. They're dead and gone. And I don't make friends easy. And so therefore, I find myself in a situation where I have to face many of life's trials alone. And the Women's Circle and the counselor here, they are very helpful to me because sometimes, I don't know where I would be without the Women's Circle and the counselor that I see here. For me, it's a lifesaver.
American Indian Health and Family Services of Southeastern Michigan had its humble beginnings as just a nurse doing screenings at the local Indian Center. Aihfs was founded in 1978. Originally called the Detroit American Indian Health Center, it had several homes until settling at a site on Livernois in Detroit in 1986. All services were delivered from this site, except social events which were held at a satellite site on Lanyo called the Family Social Center. In 1993, the health center was destroyed by arson. The community and staff, showing dedication and commitment, rallied to keep services available. Whatever could be salvaged was moved to the Family Social Center. Medical services were moved to our doctor's family practice in Royal Oak, then to Grace Hospital, and eventually to our clinic on Verner. Dental was moved to our dentist practice in Waterford. Counseling services were at various other local Native agencies where space was donated. The agency operated in this manner until late summer 1993 when the Archdiocese of Detroit donated a church and rectory building. The rectory site became the administrative and counseling offices with the medical and dental remaining off-site. The church was used as a social hall. Healthy Start.
My name is Nina Yusani. I'm a maternal child health nurse and I coordinate our Healthy Start program here at American Indian Health and Family Services. Healthy Start is a maternal child health program. Everyone around here tells us that we have the best job here, and I think they're right because getting to work with pregnant moms and with families with new babies really is just about the best thing there is.
Help you think about any challenges that are going on with her and help think of fun activities and play things for her to do. and often they'll work with you until she's 4 or 5.
Parenting program.
My name is Josh Schuyler. I am the coordinator for the ANA parenting program here at American Indian Health and Family Services in Detroit. This place is important because it provides a cultural center for some of our families in the community. We're spread out across 7 counties in Michigan. And this place acts as a center both culturally and provides assistance for some of the families in the area and a place to meet, gather, eat, come together. Part of the parenting program brings some of the parents in and helps them get in contact with some services that they might have some difficulties accessing. We are a focal point for them to come in and receive help and act as a support for them and their families for medical attention, behavioral health, substance abuse. We kind of help guide people into services that they might not otherwise been able to access without coming into our program.
Dream Seekers Youth Group.
Hi, my name's Martha Hinojosa, and I work here at American Indian Health and Family Services. Yeah, it's very important, the line of work that we do here at Indian Health when we work with our youth. Our most important is keeping our youth drug-free, alcohol-free, tobacco-free, and just taking care of their body, their whole body as a whole. Again, it goes back to staying on that red road and nurturing our bodies in a good way, and feeding them healthy and teaching them health education and be the best that they can be as Native people.
She always has a really positive attitude. She's always happy.
And she's featured on the Dream Seekers album. Yes, she is. Woo. Along with Maya Miles.
A little bit of my teachings, the traditional healing, it's how our communities were before pre-contact, let's say. This is how we problem solved, how we healed our sick, how we communicated, how we socialized even with a lot of traditional ways. And so our plants that we have around us every day that we see, those are our traditional medicines, and they're things that we've gotten really far away from. And especially in an urban setting, it's harder. We don't see as many plants. We don't see as many of our traditional healers in this kind of setting that would allow for our community to be together as a whole. Healings are important, especially traditional healing, because of the historical trauma our people have endured over the years. There's a lot of healing still that needs to come for our people to live in balance. When I say in balance, we have a way of, we view life as a circle. From birth to death is a circle. Our spirituality, our health, our mental, our social, it's all a circle, so it's all one. And a lot of times our community, through the historical traumas that we endured, are missing the spiritual part, which begins with our traditional healers. And in that way, the traditional healers, when they come in, we're able to bring them in to this urban setting or to American Indian Health and Family Services. That brings back that balance that a lot of our people and a lot of our community members are lacking. So in that way, we help aid the balance and bringing the balance back, and then bringing the balance back, we help heal our communities and the people within our communities. And when they start to heal, they start to live a better lifestyle. Minobinmaadziwin means a good life, and that's what a lot of Ojibwe, Anishinaabe people and people of all nations, they strive to live a good life.